All right, good afternoon, everyone. Good morning for some of you. Thanks so much for joining us. Very excited for our webinar today on 2023 health trends. My name is Ethan Rigotis, Senior Director of Marketing here at MadPow. If you're not familiar with MadPow, we are an experience design consultancy. We are part of Tech Mahindra's Experience Design Services Group, XDS, and we've been working to improve experiences in the health space for over 20 years now. And for the past few years, our host and presenter today and author of the 2023 Health Trends Report, if you've read that, Tiffany Mura, she's been leading that work. And she's joined by Rachel Acker, VP of Experience Strategy and Research, who leads a team of experts in systems and futures thinking, business strategy, org change, experience research, the list goes on, all with a big focus on reimagining health services through innovation. So very quickly, before I turn it over to Tiffany and Rachel, a few housekeeping notes. This session is being recorded, and you'll get a link to that recording via email in the next week or so. We'll have at least 10, 15-ish minutes at the end for a live Q&A, so please submit your questions in that Q&A tab on the top. There's also a chat function that you can use to talk with fellow attendees. I'll ask that you use that too, just if you have technical issues, post there rather than the general Q&A. So with that, thank you again for being here, and I will hand it off to you, Tiffany.
Excellent. Thank you so much, Ethan, and welcome everybody. We're delighted to host you here today and talk more about what we expect in 2023. I'm going to go off camera while I present, and I will be back on when we're done to join Rachel for the Q&A. All right, so taking a look at what we expect to see in 2023. We're going to look at 5 key trends today. But before we jump into that, I want to talk about 2023 in a nutshell. We believe that the US healthcare system is reaching a critical crisis point. Fears of collapse during the pandemic were not realized. However, we've emerged from the pandemic in even a worse state than when we went into it, an even more precarious state. And I talked about this back in April at our Health Experience Design Conference, and things have actually gotten worse since then. Even McKinsey's talking about this now. We're at a bad spot. I'm hearing it firsthand from the providers that I talk to. We're facing challenges on every front, from severe labor shortages to supply chain issues, to record inflation, to increased patient demand and acuity, to huge clinician burnout and a large exodus from the industry. The economy is at the same time, we have so many promising opportunities to fix these challenges. Retail health is continuing its expansion to bring more care to more members of the population. AI technology is coming of age. There's been a huge movement in consumer-driven healthcare, where consumers are taking health management into their own hands, selecting to wear wearables to monitor their health, and now having ownership of their health data. You know, back in April, I asked the question, why aren't we seeing the same cross-industry sense of urgency to address the looming crisis as we did at the beginning of the pandemic? You know, I think we all feel it on an individual level with the work we do in healthcare and as healthcare consumers in the system. But I keep asking myself, why aren't companies partnering and innovating with the speed and efficiency that they did during the pandemic? Maybe it's because we're not seeing it on the evening news, not seeing reports of how many people have died because they couldn't get the care they needed or they couldn't afford their medicine. I don't know. I don't have the answer to this. But we all have a stake in this game, both as practitioners and as consumers of this system. And I urge you to consider this question in your day-to-day roles and how we as collective memberships can reinstill this sense of urgency to make these fixes, to take advantage of these opportunities while we still have the chance. So what are we going to look at today? We are going to start with these converging factors and taking a deeper dive into them. Then we'll get out of it a little bit of the doom and gloom and talk more about healthcare anywhere and omnichannel, consumer-driven healthcare, implementing AI to solve key challenges, and deepening focus on equity, accessibility, and affordability. So, taking a look at the converging factors, we're going to look at staffing shortages and clinician burnout, rapidly increasing healthcare costs and decreasing affordability, and more patients needing more care. This issue of staffing shortages and clinician burnout, which is something you're going to hear a lot of through this entire report because everything is interconnected, is a compounding problem. The problem existed before COVID. It was exacerbated by COVID. And now I would say it poses one of the most significant threats to the stability and sustainability of our healthcare system, because clinician burnout and exodus from the industry reduces the quality of patient care. It leads to more medical errors. It drives increase in illness and death. It accelerates the already inflating healthcare costs, and it worsens health disparities. So it affects every part of the system. Now, the pandemic departure rates have slowed somewhat, but the burnout and dissatisfaction rates still continue to increase across the board. For physicians, changes compared to 5 years ago have been very significant, with the most dramatic increases starting in early 2020. And as recently as July of 2022, 64% of nurses are looking to leave the healthcare profession, which is roughly around the same percentage of physicians reporting burnout. We are expected to face a shortage of more than 200,000 registered nurses and over 50,000 physicians in the next 3 years in the US. Those nurses are the center point of quality care before they even get to the doctor, because they're the ones on the front lines working with the patients. Wheel, the virtual healthcare platform and telehealth provider, did a survey recently, and 1/3 of the patients that they surveyed said that they believe their provider's burnout is negatively affecting their care. We need to find ways to fix this, and we are going to talk more about those. So what are some of the universal recommendations? The number one is to fix the EMR usability issues. We do a ton of experience research here at MadPow with physicians, and I can predict with almost 100% certainty that the first thing they're going to list when we talk about any problem that they're having is that it's somehow related to the EMR, because it often is. The EMRs were developed without a user-centered design. There's interoperability issues. It makes their work very challenging. It stands as a barrier between them and the patient. We need to employ technology to help automate routine tasks, more flexible staffing models to allow folks who maybe left because they want to stay home with their kids or have a more flexible work schedule that they can't get in the clinical setting. And we need to provide mental health support to help them cope with the day-to-day issues. However, the mental health support is a Band-Aid. As Christine Sinsky says, she's the AMA Vice President of Professional Satisfaction, and the AMA is doing a lot of work to help with this problem. While burnout manifests in individuals, it originates in systems. It's not the result of deficiency among physicians, but due to the systems in which they work. And Dr. Tate Shanafelt, who's a real pioneer in the space, and I believe the first chief wellness officer named at a medical school, he's at Stanford Medicine, said, we need to not be trying to teach or train physicians and other healthcare workers to better be able to tolerate a broken practice environment. We need to fix the practice environment. The second pressure and challenge is rapidly increasing healthcare costs and decreasing affordability. So the combination of increased inflation, clinical staffing shortages, and this ongoing pent-up demand from COVID-delayed medical care, the burden of mental health and other chronic issues, is anticipated to add up to $200 billion in additional annual costs over the next 5 years, which is burdening payers, consumers, and the rest of the industry. The expected employer healthcare cost increase in 2023 is anticipated to be 6.5%. $13,800 on average for an employee. This means that they're going to shift the cost to the employees or shift the employees onto higher deductible plans. In 2020, 40% of employees were on high deductible health plans. We expect this percentage to increase a lot. And in 2021, the average estimated annual family healthcare costs before coverage were $8,000 to $12,000. The frightening part of that is that the average household savings rate in the US is $20,000. So that means if they have to utilize their health insurance, a large part of their savings is going to get eaten up by their healthcare cost contribution. And 45% of consumers in a recent survey said a $10 increase in the cost of a physician visit would make them avoid it. And again, that goes back to this vicious cycle, which we're going to be talking a lot about today, because if they defer care, they are going to end up showing up sicker at a later date for whatever reason. So what's being done to help? There's some really promising developments in the Affordable Care Act. The enhanced marketplace subsidies are now going to continue without interruption through 2025. The infamous family glitch is fixed. And for those of you unfamiliar with the family glitch, within the marketplace, the qualification for a family was based on the cost of an individual plan premium. Even though the family needed coverage for the entire family, that has been changed. So eligibility is going to be calculated on the full family rate. Other eligibility rules have been relaxed as well. Folks who were delinquent in payments or had non-payment issues are now being allowed to participate in the marketplace again. We've got some private sector initiatives as well, such as Mark Cuban's Cost Plus Drugs, which is taking 1,000 of the most commonly prescribed generic drugs and selling them at cost plus a 15% markup, which is good for seniors who are on a fixed income, but most especially for those who are uninsured and can't afford their healthcare, their drugs to support their healthcare, because they, as uninsured people, are lacking the pharmacy benefit manager, which is helping negotiate drug costs down for those who are on insurance plans. The prescription drug reduction efforts in the 2022 Inflation Reduction Act are also focused on reducing drug costs. And there's been a lot of virtual first health companies coming into business. Omada and Teladoc were two pioneers here, but they're really looking at that combination between telehealth and in-person care as a model to help drive overall cost of care down for both consumers as well as employers who are, you know, small companies that may have not been able to offer health insurance previously without this model. And the third pressuring fact is more patients needing more care. During the pandemic, there was this deprioritization of health. And as Chris Dorenzo, who's the senior vice president at Wake Med Health in North Carolina, says, what it's done is create a population of people who have conditions that they never would have developed in a pre-pandemic environment. What does this mean? During the pandemic, there was a large amount of deferral of routine care and tests. First, because of lockdown and those being postponed by the system itself. But secondly, once people could start going back for it, they often avoided the clinical setting because they were afraid of catching COVID. At the same time, a lot of folks stopped exercising and pursuing their healthy lifestyles. There was also a concomitant adoption of unhealthy behaviors to cope with the pandemic stress, be it excessive drinking, taking drugs, eating a lot of junk food, not sleeping well, and of course, all the mental health problems. Those are all coming together and driving an increased level of patient acuity, that is, the amount of care needed by a person. It was nearly 10% higher through the end of 2021 compared to pre-pandemic levels, and it's expected to rise in 2022 and 2023. So back to that vicious circle. When you have sicker patients showing up, it increased cost of care. Hospital labor costs were up 12% from 2021. The most frightening part about this is that this is not a near-term problem only. This is supposed to stretch far into the long-term horizon. Cancer deaths are expected to continue to increase over the next 10 years solely from the amount of cancer screening that was deferred during the pandemic. All right, I'm sure we all need a little break from that. We're going to talk about some more exciting trends and opportunities and more positive ones. This idea of healthcare anywhere and omni-channel, where technology is being leveraged to, and non-traditional players are being leveraged to transform care delivery. We all know the pandemic was a game changer for health anywhere and omni-channel. By telehealth having to be adopted to support care during lockdowns and social distancing, the industry was catapulted ahead 5 years in a matter of weeks. Remote monitoring was adopted on a larger basis, a very much ad hoc basis, but a larger basis to help shift care from the clinic to home in light of the pandemic situation. Both of these initiatives gave consumers a taste of what they were experiencing elsewhere in the industry outside of health, and that they've been experiencing outside of health for a long time. And we've opened the Pandora's box. You know, now that consumers have a taste of this and know that it can happen in healthcare, they want more. The first trend we anticipate there is the continuation of telehealth and remote care. We believe it will continue. It'll continue to expand, though CMS is grappling a little bit with it on what parts to make part of permanent coverage within the governmental plans, but we do believe that will go through. However, it needs to mature into an integrated user-centered experience. When telehealth and remote monitoring were implemented during the pandemic, it was done in a crisis setting. It had to be done quickly. I mean, we got the entire industry onto telehealth in like weeks, you know, an initiative that would have taken years in the past. But it came at the expense of the user centricity of the experience. this needs to be corrected. We do believe not only will remote patient monitoring continue to increase, but it'll also likely start to converge with personal wearables. The thing about remote monitoring is it really can improve reduce the cost of care and improve the outcomes. People are more comfortable being in their home setting. They can be monitored on a more regular basis and have their treatment adjusted in real time versus having to wait until an acute episode. It offloads some of the more administrative and facility burdens for doctors, nurses, and other clinical professionals, which will be great for the burnout problem. And it's a great support for rural populations, which we'll dive into a little bit more later on. I talked a little bit about the proliferation of telehealth companies. This is just a small sampling of them. Even ones that are specific to health plans like CloseKnit, which is for the Blues. The second trend we're looking at in trend 2 is more effective delivery of customer and patient centricity. We just talked about that in the telehealth concept, but we need to be looking at this across the industry. The healthcare companies have grown up without this orientation. And a fully consumer patient-centric organization would be using the voice of the patient and consumer to help inform every business decision. They'd be implementing and supporting a consumer patient-centric collaborative culture that works together to meet consumer and patient needs. And they would be measuring and rewarding on metrics that were central to the consumer and patient. As you know, that's not happening across the industry at the moment. However, strides are being made. Merck, Pfizer, and Sanofi are some of the life sciences companies who have named a chief patient officer, which is bringing the patient into the executive suite. And that's exciting because now that you have a chief patient officer in the C-suite, they can start implementing some of those changes from the top down that can really bring these organizations into a fully patient-centric situation. Some pharma companies are also starting to examine the patient experience at an enterprise level across the entire disease state and drug development life cycle. The FDA has their Center for Drug Evaluation and Research has their patient-focused drug development program. And CMS is doubling the weight of patient experience in the consumer assessment of health providers and systems metrics, which is a very important metric for governmentally funded programs. It's doubling the weight there. So you see these examples across the public and the private sector. Third trend in this bucket is decentralized and remote clinical trials. And this kind of plays off the other two as well. Bringing the trials to where the patient is versus requiring them to come into the facility. COVID, again, drove rapid innovations in this area and accelerated the adoption of decentralized and remote clinical trials because they had to. Without doing that, these trials would have come to a standstill during the pandemic. There's 3 key benefits for the trial sponsors: faster trials, lower cost trials, and more diverse trials, which actually also in turn benefits the trial itself. Adoption's being driven by continued regulatory acceptance of the practice, more mature monitoring tools, increased patient and clinician comfort with the technology, and of course, like I said at the beginning, convenience for patients. Some of the signals we're seeing of why we think this trend is going to continue to increase is a recent survey by Thermo Fisher. 87% of the respondents said the pandemic had either substantially or transformationally impacted their ongoing clinical trials. And 58% said they were so successful with this new mode of research, they would not revert back. The other interesting trend in the space is retailification of healthcare. The non-traditional players, Walgreens, CVS, Walmart, Amazon, are continuing to expand their reach into health services, from diagnostic testing to primary care. The US retail clinics market is projected to grow from $2.5 billion in 2022 to almost twice that size in 2029. And they are providing a one-stop shopping experience and trying to lean into this holistic version of healthcare. They also gained traction during the pandemic because they started offering COVID tests, and it sort of got folks used to having that model of going there for diagnostic testing and for vaccines, and realizing this was a great alternative to having to go into an actual healthcare facility. The downside is that they don't have the full integration with the rest of the health system. There's not EMR integration. They aren't networked into the specialists for the continuity of care. However, they have the infrastructure, capacity, and customer service orientation to really fulfill on the omni-channel experience. So if they can overcome that hurdle of the integration and being able to connect with specialists, I think they're going to be a powerhouse to contend with. Especially because they have the advantage of location. There's a statistic that 90% of the US population lives within like a 3-mile radius of a Walmart or 10-mile radius of a Walmart. It's a pretty high, it's a high number and a close range. So this is an excellent solution for those folks who are in a rural setting that can't get to a primary care doctor easily. So as we're talking about consumers and retail playing into this, I want to talk a bit about this idea of consumer-driven healthcare. Another thing that started to really come of age during the pandemic, which is an odd dichotomy, because I know I just talked about this a few minutes ago, about how the pandemic caused a great deal of decreased and delayed healthcare. It also simultaneously accelerated this idea of consumer-driven healthcare. Consumers started adopting healthier lifestyles. At the same time, some were adopting unhealthy lifestyles. Other folks had the time to exercise more. They invested in wearables. They started looking outside the traditional healthcare system for other healthy lifestyle solutions, whether it's adopting a vegan vegetarian lifestyle, utilizing functional beverages for getting more nutrition. That is an industry that has exploded, and you see those little pockets that are outside the traditional healthcare space, but very health focused. So what do we think is going to be driven by this? A first key trend in this bucket is the convergence of clinical driven and patient driven remote monitoring. So we talked about COVID accelerating the industry investment in remote patient monitoring, but at the same time, there's been a proliferation of cost-effective consumer self-monitoring tools to expand this opportunity. Some of these are directed primarily towards eventual clinical applications, and then there's the self-adoption of monitoring tools via wearables. We believe that this increased size of remote monitoring will really be a huge opportunity if the idea of convergence is realized. Obviously, there's a lot of hurdles to be overcome, but with an expected 93.7 million people expected to be wearing wearables by 2025, it's a good almost 30% of the population. There's going to be this huge wealth of longitudinal health data that remains untapped and could bring an enormous amount of value. So we do believe that this is going to start happening. One of the earliest signals of this is Rune Labs, and they received FDA clearance to use the Apple Watch combined with other sources, including a Medtronic implant to measure brain signals, to longitudinally monitor patients and determine how to fine-tune treatment for MS. So really interesting example of a true individual-focused wearable combined with a remote clinical device in delivering a healthcare solution. The other piece of interesting developments in this space is not just the individual health, but collective health. So Aura has put together a program called Aura for Business, and Aura is the ring that you wear to monitor health statistics. And they're combining the personal insights provided by individual Aura users with analytical tools and insights for organizational leaders based on group data to help companies take action on employee well-being metrics. I personally find this a little creepy, but it does have some interesting implications in this idea of how wearables can contribute to analysis of population health in a variety of settings. Another interesting aspect of this focus on health that happened alongside the simultaneous deprioritization of it is that those consumers who were focusing on health have increased their demand for brands outside of the health space to support their health and do it inclusively. The global wellness market is currently valued at $1.5 trillion, and it's growing at a rate of 5 to 10% annually. And that's enormous. And this idea of companies being in the health business, even if they aren't traditionally in the health business, really, again, got footing during the pandemic. Because during the pandemic, every business was a health business because they had to actively manage the health of their employees and customers. And now these trends have continued outside the pandemic context. Employers are investing more in employee well-being. PwC has a great program to look into I believe it was $6 million that they've invested into this and looking at the employee's whole health. Airlines are partnering with meditation and fitness companies for in-flight offerings. And Best Buy is positioning their health technology as healthy living starts here. So in addition to having a whole B2B market to try to sell those home monitoring tools into healthcare companies, they are also developing health and wellness programs for consumers, including programs for aging at home and skincare programs. Barclays customers have access to mental health services through the Barclays banking app and website. And when I first saw that, I kind of asked myself, well, wait a second, that just seems weird. Like I would never think to go to my bank looking for mental health. But in the PwC work on employer health benefits and wellness benefits, one of the studies they did indicated that financial wellness is a key component to overall well-being. And so it kind of makes sense because, financial wellness can be one of the biggest sources of stress. And now I can see the logic behind what Barclays is doing. And then we've got Galeries Lafayette, which is one of the biggest department stores in the world, the most prestigious in Paris. And they are developing the Wellness Gallery, which is offering experts in wellness, beauty, self-care, and sports, as well as personalized services based around workouts, self-care routines, and wellness through food via restaurants and rituals. So really interesting examples, but there's a ton more out there. And this idea of supporting health and inclusivity. One of the most interesting examples I found of this recently is something that L'Oreal debuted at CES. L'Oreal has already been innovating in this space. Last year, or 2021, they had partnered with the Clue Period tracking app to help develop hormonally informed skincare. And then at CES earlier this month, they launched Hapta, which is a handheld, ultra-precise smart makeup applicator for users with limited hand and arm mobility. So it offers them the ability to steadily apply lipstick at home. And for all the women out there who don't have any mobility issues, you know how hard this is to do, to apply lip liner, even regularly. This is a huge advancement for these folks. And there are an estimated 50 million people who have a fine motor skill limitation. So it's going to serve a huge population. Keep an eye on L'Oreal. They're going to be doing some interesting things beyond this, I believe. All right, moving on to the third trend in this bucket, the patient-mediated data economy. October 6, 2022 is heralded as Data Liberation Day. As part of the 21st Century Cures Act, the final rule information blocking provisions went into effect, which in essence means that organizations are now required to provide patients with unrestricted access to their full medical records in electronic format. It's ultimately going to benefit both patients and providers. It's being heralded as the onset of the patient-mediated data economy because individuals will have control over their personal health data. Now, as with anything, promise versus practice is going to take a little while. There's interoperability hurdles that are going to continue to complicate this, as will other unresolved issues such as information sharing protocols, access rights, and really what it means to be required to give patients access to their data. But the faster these can be overcome, the more promise of this data economy can be realized. One example of a company that sprouted up to help with this is One Record, which is an app to allow you to collect all of that data into one single spot as an individual healthcare consumer. Lastly, in this area, precision medicine. Precision/personalized medicine is medicine that takes into account the uniqueness of each patient's genetic data, medical history, environment, and lifestyle. Advances in big data, AI, genomic testing, will enable the full potential of this medicine to start to be realized across a range of conditions. Currently, it's being utilized primarily in oncology and rare disease, but now, it can start to inform population health as it would enable grouping of individuals with similar characteristics and risk profiles. And there's been a recent development in its ability to treat common diseases. In 2022, Verb Therapeutics cholesterol-lowering treatment, which relies on CRISPR 2.0, a more targeted approach to gene editing called base editing, was implemented in a woman for the first time. And this should be theoretically a safer approach to gene editing because you're less likely to cut an important part of that gene by mistake or have some error show up in when the DNA is repairing itself. But this is a real seminal moment in being able to apply precision medicine, personalized medicine to a much larger occurring disease than something in oncology or rare disease. All right, shifting on to AI, implementing AI to solve key challenges. So there's been a rapid evolution of AI over the past few years, which is making it not only a viable but needed tool to help ameliorate the biggest challenges in the healthcare space. It could help reduce cost, increase efficiency, improve care delivery, reduce clinician burnout, and help transform the industries. These opportunities are so vast, I could have done an entire report solely on this, but we're going to highlight the 5 that we think are the most potentially influential. Starting with accelerating early drug discovery. AI offers a myriad of potential benefits here. It can help more quickly and accurately predict candidate compounds, find models which work best for a specific biological target, and predict toxicity. It's going to be part of a massive industry-wide change, and I believe prime movers will be the first to realize the benefit. And you'll realize cost savings and the speed of innovation and scale, but that has to be done through partnerships and a combination of partnerships and internal capabilities, because it's going to be hard to bring in-house immediately, because it is going to require a complete transformation of the drug discovery process, which is difficult for an existing organization to do overnight. So it's good for them to start partnering with other organizations who are solely focused on this. And this is happening right now. AI-fueled pipelines are expanding at an annual rate of almost 40%. It's almost doubled over the last 5 years, the AI-enabled drug discovery, and it's expected to reach more than 5.2 billion at the end of 2021. Biotech companies that are using an AI-first approach have over 150 small molecule drugs in discovery and more than 15 already in clinical trials. I think much like Moore's law of computing, you're going to see a hockey stick increase in this area. AstraZeneca is a pioneer. They are transforming their scientific capabilities in order to accomplish this. And part of what they're doing within this realm is unifying their data into a centralized architecture. So they were already able to realize the benefit of that in 2020 when they established validated clinical environments within 24 hours to begin working on evaluating COVID, something that would have taken weeks or months without the work that they had already done to build out this AI bench of data. They've also recently partnered with Illumina to explore whether the application of AI to DNA and other omics sequencing data can increase their returns in finding successful biologic targets and potential drug candidates. Moving on to digital twins. This is a really cool area. A digital twin is a digital model of a real-world system that can be used to study whatever has been replicated at a fraction of the cost and with almost none of the risk. The applications can range from human-focused disease modeling within organs or at the cellular level to study treatments, to the creation of personalized medical devices such as prosthetics, to modeling systems operations within clinical settings to improve efficiency. This market's also supposed to grow a lot. 39% increase in compound annual growth rate from 2022 to 2030. In 2021, the market was already valued at $7.4 billion. Some of the most interesting examples are NeuroTwin, which is creating personalized hybrid brain models for individualized therapy for epilepsy and Alzheimer's. They have clinical trials scheduled for this year. Dassault Systems, who is practically in our backyard here out in a Boston suburb, has a Living Heart Project where they are creating models to establish a unified foundation for cardiovascular in silico medicine and to serve as a common technology base for education and training to med device design and testing. And in December 2022, Abs Medical obtained FDA approval in the US for its medical device called Surgiverse, which is the first surgical decision support software suite outside the metaverse. And it really is composed of two interconnected products. First is the surgery planning platform, which essentially allows the clinician to make a digital twin of the person being operated on, and then also a cockpit that can be used during the actual surgery. So they've got this digital twin to plan the surgery and the cockpit to monitor the surgery. Keep an eye on those three for sure. AI also has a lot of promise in the clinical trial space. It can support almost every aspect of clinical trials: trial design, target site and candidate identification, data collection, analysis and interpretation, and trial recruitment. Opal's one of the companies pioneering in the space. They're using AI to mine social media content to help identify patients using predictive technology and analysis of digital biomarkers and social media behavior to identify and predict geographic concentration of potential candidates for trials within specific areas. There's also the opportunity to reduce clinician workload and increase efficiency. One of the key contributors to clinician burnout is the patient-facing workload: notes transcription, notes review, test results review, general admin review. And offloading appropriate work to AI could really help clinicians focus on the most important tasks. It can improve their efficiency, reduce burnout, and improve quality of care. Some of the key opportunities, and I mean, there are many, just talk about a few here today. Clinician scheduling. A lot of the reason that clinicians are leaving because they want to have a better work-life balance, and using AI to model scheduling will allow them to do that. Verbal note transcription, so clinicians can interact face-to-face with the patient instead of facing the EHR on the computer. AI triage of patient symptoms to determine an appropriate level of care. One good example of that is the company K-Health, who recently launched a pediatric program that utilizes AI to triage pediatric patients' symptoms via what the parent has entered, and also allows a combination chatbot, real chat with clinicians to determine the next steps in care. Cedars-Sinai also launched a more physical implementation of this, where they tested Moxie robots to assist nurses in performing the routine but time-consuming tasks like delivering lab samples, getting medication, getting supplies. And in their 6-week test, it saved clinical teams more than 300 miles of walking. Next is clinical data sense making. There is a massive amount of data collected and analyzed in healthcare. It is estimated by some statistics that 30% of all the world's data volume is generated by the healthcare industry. The problem is that much of this data value goes unrealized. And the more we can unlock the value of this data, the more it can help the healthcare system and healthcare system consumers. Some of the key opportunities for AI utilization and data sense making include proactive notifications to clinicians of health problems, real-time support for clinical decision-making within the healthcare system, predictive models for likelihood of future disease. And the reason it can do this is, even though it can't solve interoperability issues, once it gets the data, it can process vast amounts of multi-source data to accomplish these. So before we move on from AI, I want to talk a little bit about what's slowing the adoption of AI in healthcare, because it's being adopted much more quickly in other industries. And if it has so much promise, why aren't we getting it in place faster? Well, here's a few reasons. There's a lot of hurdles to surmount that are unique to healthcare. First being black boxes and trust. With the advances in neural networks, is push the boundaries of AI and what it can do, but it's done that at the cost of interpretability. So when neural networks are used, it's difficult to understand how a specific prediction was generated without substantial effort to proactively look for potential problems. So that means that some algorithms become so-called black boxes, and that makes physicians concerned or other clinicians concerned because they will likely be held accountable for the decisions that involve AI. And just to go a level deeper on this, if you don't invest in proactively identifying potential problems with a neural network generated algorithm, there's a substantial risk that solutions that are produced may be flawed and only discoverable after they've been deployed. Bias is just one example of that, and probably one of the less acute in the clinical setting, but more problematic for the healthcare system as a whole. The lack of transparency, because this black box issue reduces trust, and we really need to have some complementary innovation in the industry to develop trustworthy AI through processes that can streamline and facilitate this interpretability issue to help healthcare workers understand how a recommendation was achieved and potentially identify problems. The next one is data access limitations and data complexity. AI algorithm performance is contingent on data quality. So a barrier to adoption is limited access to this data or small data sets, both problems of which are really common in healthcare. Small data sets emerge because it's a rare disease or diseases with smaller incidences. Medical data is often difficult to collect and access. One, because it's, the collection of it in some cases, like an EHR, is interfering with day-to-day workflow. So it's done, the clinician's trying to examine the patient and enter the data at the same time, so it might be incomplete. But on the system-wide level, it's difficult to pool this data across companies and clinical settings. And even life sciences companies that have had mergers have trouble pulling the data together within their own companies. So this really has to be overcome. There's regulatory barriers on who owns the healthcare data and who can use the healthcare data, how the devices are approved and how the software is approved and how quickly it's approved, and where the liability lies between medical providers and AI developers. We need complementary regulatory innovation to address this. And misaligned incentives. The role of decision makers is highly dependent on whether AI will be adopted or not, because if these decision makers are clinicians whose jobs will likely be displaced by the use of AI, they might be slower to adopt it. All right. Our last trend bucket here is trend 5, which is the deepening focus on affordability, equity, and accessibility. To truly fix our healthcare system, we've got to fix it for everyone. We have to remain focused on affordability, equity, and accessibility. And affordability is becoming much more of an issue in this space with all of the inflationary increases and increased cost of care. Individuals are having a harder time than ever affording healthcare, and that's expected to grow. A recent survey by the Commonwealth Fund showed that 43% of adults, working adults, were inadequately insured. And Chapter 11 bankruptcy filings for large healthcare organizations are expected to be 28% higher than in 2021, which is going to further challenge the accessibility of care for certain segments. And rural hospitals are especially at risk. More than 30% of them are at risk for closure. And the communities that rely on these hospitals tend to be older, sicker, and generally in the minority population. So what do we need to do? We need to remain focused on culturally competent care, underserved populations, and SDOH needs, the social determinants of health needs. These trends are there. We've seen a lot of improvement in providing culturally competent care and a lot of efforts to improve equity. And really, the focus on SDOH is being supported a lot right now by CMS's new SDOH quality measures that go into effect this year, requiring hospitals to report population screenings for SDOH and positive screens by category. The NCQA are going to be adding social needs screening and intervention to the HEDIS metrics. And Medicare managed care organizations will have to screen new enrollees for SDOH needs within 90 days of enrollment. An interesting bright spot within the concept of culturally competent care is Brightline. There's many initiatives in this space, but I particularly like Brightline as an example because they partnered with Violet, which is a company focused on building health equity through increasing cultural competency in care delivery, and ran a pilot where Brightline was able to triple their capacity for inclusive care and increase overall inclusivity by 70%. Another key factor is climate health as a new social determinant of health. Climate affects health outcomes. Extreme weather events delay medical care, dislocate families, and worsen the health of those with chronic diseases. The federal government established the Office of Climate Change and Health Equity in 2021, and the NIH has identified key impacts and intervention strategies for climate change, as well as examples of needed research. And in a statement from the EPA, they said the effects of climate change disproportionately fall on underserved communities who are least able to prepare and recover from them. These include air quality, extreme temperature and labor, extreme temperature and health, coastal flooding and traffic, and coastal flooding and property, and inland flooding and property, all of which trickle down to health and whether or not folks can get health care. This is going to need to be a continued area of focus, especially as climate change continues to worsen. And last but not least is solutions for rural patients needing care. There has been a decreased life expectancy in the US for a variety of reasons, partially the primary care support problem. Patients in rural areas often have to travel much further to reach primary care and even further to find a specialist. And as a result, some patients forgo care or leverage a PCP for care that should be provided by a specialist. Retail health is helping with this, but again, like I said, they don't have the access into the specialists like they need to yet. Home health, hospice, and palliative care, and mental health and substance abuse services are in short supply in rural areas. There's reduced health literacy, there's reduced broadband access than in urban areas, and privacy is harder to maintain. 9% of US counties are in a primary care desert. Homeward Health is a nice bright spot in this area. It's a public benefit corporation that's founded to help provide comprehensive healthcare services and solutions in these populations that lack access to care, and their initial focus is on rural areas. I think we can continue to see increased area of focus in this aspect of accessibility and inclusivity as well. And that is a conclusion of our trends report for 2023, and we're going to turn it over to Q&A now. All right, Ethan, what do you have for us?
All right, do you want me to read these questions off to you, Tiffany?
Yep, I'm just getting my screen back here.
Sure, yeah. So first question here, this is kind of a little bit of a two-parter. First, do you have any insight into the impact of consolidation in the US healthcare system on digital health, especially as it relates to providers? That's part one. Second part, with the rate of consolidation increasing significantly during COVID, would tech/IT backend consolidation make implementation of digital health solutions actually more feasible?
To start with the latter, yes, I think theoretically it should make it more feasible, but the fundamental problem is that integration just with the EHR systems is not as simple as it sounds. Although the majority of the industry is on the Epic system, a lot of the implementations are custom implementations. So these consolidated organizations are going to need to consolidate their EMR systems and normalize their EMR systems across their internal organizations, which is going to take quite a bit of time. So realizing any benefit from that consolidation as far as deploying digital health solutions across sort of a lower number of big players is going to be slow to be realized. And secondarily, the problem with Epic and the other EHR systems is they don't really have an easy way to incorporate some of the outputs from these digital health solutions. And until that problem's overcome, it's also going to be a challenge. And, to quote somebody who presented it at HXD, he said, we don't need another app, we need an API, and that's what we need. We need the APIs to help with this. And then the beginning part of that question, Ethan, can you just read that again? Is it going to make it easier to deploy to professionals? Was that the part of the question?
Yeah, do you have any insight into the impact of consolidation in the US healthcare system on digital health, especially as it relates to providers?
Yeah, I think it's going to be fewer systems to sell into, but the technological barriers are still going to remain.
Awesome. All right, next up here, the personalization on the individual level makes sense. Can you speak more to the personalization based on specialties, especially related to EMR?
Personalization based on specialties is related to EMR. I'm going to ask that if the person's still on who's asking that, if they can provide me more detail on that question, and we move on to something else, and I'll get back to that one.
Sure, no problem. And if you just want to put that in the chat, we can go from there. What's your perspective on patient trust? As tools like AI advance, how do we help build patient trust in these tools?
Yeah, I think that's going to be a huge issue. I mean, I'm going to turn that one over to Rachel, but I'll just say in short, I mean, there's already a lack of trust within the overall healthcare system, and that black box issue I talked about, patients already feel like a lot of what decisions are being made are outside of their control and their influence, and turning it over to computers, I think, is going to make them more scared of that. So I do think that's an important area to address. Rachel, you want to take a little stab at that too?
Yeah, exactly. So the trust issue, it's because the human-centered, the interaction with the device is going to be changing altogether, or the way that we do things are going to change so dramatically, especially with generative AI like ChatGPT, when that starts coming out as a way to, the trust levels are going to be that there needs to be these agents, and you need to create new experiences around these agents that will then create a different sort of consent, basically informed consent from the data that's being shared. So it's going to open up a whole new area of design experiences actually that need to be reimagined completely.
Absolutely.
Thanks, Rachel. Another one here. If we have a provider shortage, how is the retailification of healthcare going to solve that? It seems to me like they're building more facilities that will compete for the same limited talent pool.
Yeah, that was one thing I had not mentioned, but that is a big concern, because it does not solve the provider shortage. It shifts where the providers might be working and might make it more attractive. What I do think it may help with potentially is stemming the exodus of providers if they can get into systems where they are able to practice in an environment where the technology supports them better, or they're able to have more flexible lifestyles. But we still need to do more to stem the exodus and increase the inputs and folks going into that profession.
And then a follow-up there, kind of related to that. How do we ensure that all the tools being built work together for patients rather than competing and complicating navigation of the system?
Very good question. I think it goes back to that API. I mean, there is a lot of disparate initiatives going on right now, and thinking about those more holistically is going to be critical. Whether it's the health system purchasing it, these various ones, and thinking about how they're going to work together. But yes, that is definitely a systems design question that's very important. Hey, Rachel, anything to add there?
Yeah, I was going to say too, I think the interoperability part also, as the systems then talk to each other, when those APIs are in place, then that will also enable you to have a bigger pool to search for providers, for instance, and then that also ties into the retailification of healthcare, because now you can see those providers in different environments or across different health systems potentially. But I think a lot of it is going to be how long or how quickly can we see something like that actually take place? And I think that's really the question is how complicated is it going to be for us to get there?
Yeah, absolutely. I did see one question on there, Ethan, about how some of these trends are expected to impact the future of aging. And I think a lot of these trends, especially around the remote monitoring and the increase in, use of wearables and that sort of thing, is going to improve the overall aging experience, because I think folks are going to be able to more continuously monitor themselves. It doesn't necessarily answer the challenge of, getting folks to adopt the behaviors that need to be in place for a more healthy aging. But I think the opportunities to have people being cared for in their home and stay in their home, which is a better environment to be in than a nursing home or care facility, is definitely going to be a plus. I think the consumerization of health and consumers taking more charge of their healthcare, I think that is another place, because it puts them in charge of their own aging versus being dependent on the health system.
Absolutely. So I think we have time for a few more here. This one, I know, Rachel, you kind of chatted in an answer to this, but I'll ask it to both of you here. Curious what patient experience metrics are being implemented by pharma companies.
Yeah, I mean, there's a variety of things. I mean, it goes back to some of the traditional consumer metrics for, customer experience, like patient satisfaction, but it's also looking at health outcomes. Are the patients getting on therapy successfully, staying on therapy successfully, able to pay for therapy, which is obviously, as I mentioned, a big challenge. The other one here, oh, sorry, go ahead.
Go ahead.
There was a question I just saw pop in that was kind of related to the retail health one. Speaking from within the healthcare system, it helps to meet an immediate need, but not configured for continuity of care or management care for those with complex health needs. And how do you see this fitting in without creating a greater fragmentation of care? That's a huge concern. I think it is going to expand tremendously, and that question needs to be solved. And it's kind of a question of like, who's going to win on this? Because while they do have the customer orientation that they get from the retail environment and being able to provide that better omni-channel experience, if they do not get integrated within the EHRs and within the larger health system to refer to specialists, that is going to be definitely the cost of this increase in retailification. It will be a decrease in care. However, I think there's an opportunity for it also to help. It's just we're going to see how it plays out.
And maybe the last question here, what do you foresee in digital health beyond the wearables and remote monitoring?
That's a very good question. I mean, I think the integration is going to be a big key piece, and being able to get some of these personal items brought up to clinical grade data so they can be integrated. As far as specific types of wearables, I mean, I think there's a lot of interesting things that were debuted at CES, whether it be like, the home health toilet that measures, the health of what's going on at home, that sort of thing. So I think those are the types of things you're going to see is more that integrated device and software versus just yet another digital health application that sits on your iPhone. Rachel, thoughts there?
Yeah, I think we're going to move away from more apps and more into the home at sensors and more like ambient sensors or devices that are, sitting at your desk or something to like have you move after a certain amount of time. And I think it's going to move towards more preventive care as well, too, I think. And more of the, so what I did was actually also threw some of these questions into ChatGPT just to show that the power of some of these generative AI solutions are actually very powerful. So what it said were things like a virtual medical assistant, right? So generative AI could potentially have like a virtual medical assistant that can interact with patients in their, natural way, in their own language as well too, right? Answering questions and providing information about their health. And on top of like the personalized treatment plans. But it can also predict health monitoring as well too.
Yeah, that's excellent. I totally agree with all of that. And then there was another question that popped in about wearables and isn't our phone a wearable? And queuing off what you said there, Rachel, I mean, there are many ways where the phone can be an ambient device for detecting health. Sond Health in Boston here is using speech on the phone to help predict mental health conditions and other conditions. So yes, I totally agree that the phone itself is going to become one of those ambient monitoring tools.
I'll leave it to you to close up here, Tiffany, but I will just mention to folks, if you have more questions, if you have thoughts that you want to make sure MadPow's addressing, you can email us at communications@madpow.net going forward after this.
Excellent. So I'd like to thank everybody for attending today. I wish we truly had a crystal ball. This is our best guess of what we're going to see over the course of the year, but we really appreciate your questions and your participation and wish you all the best.